Ascending aorta. This is the arch of the aorta, which shows you the brachiocephalic trunk, left common carotid, left subclavian. Those are the same vessels that would be on the top of the heart coming off of the arch. So you could either use the heart for the brachiocephalic, left common carotid, or left subclavian, or here's also the arch, brachiocephalic, left common carotid, and left subclavian becomes the thoracic aorta. And here you can see the intercostal arteries, intercostal veins, intercostal nerves, and also the hemiazygos in blue. This is a vein returning blood back from the chest wall, blood from the internal and external intercostal muscles returning back to the heart by way of the hemiazygos. The azygos is tucked underneath the esophagus and a portion of the thoracic aorta, so you can't see it. Travels through the diaphragm to become the abdominal aorta. And off of the abdominal aorta, you can see the celiac trunk here, which is a vessel that gives rise to the left gastric, splenic, and common hepatic on the right side. So the liver is here, you have the stomach and the spleen, and therefore knowing where they are inside the abdomen, you know that this is the left gastric, splenic, common hepatic, and just underneath it is the superior mesenteric. So the superior mesenteric is going to sit in here just like that. Here you can see the superior mesenteric here, inferior mesenteric here, that's where they're headed, and over here, superior mesenteric and inferior mesenteric. So, superior mesenteric gives rise to a number of vessels, but on your list, we have the right colic, ileocolic. This is the ileum that's connected to the cecum by way of the ileocecal valve, so ileocolic. And then you have the intestinals. The intestinals service, obviously the small bowel, not shown here, but that's the order. Right colic, ileocolic, intestinals, and that's all coming off of the superior mesenteric. From the inferior mesenteric here, and also over here, you now have the left colic, left side, sigmoid, S-shaped, large intestine, and superior rectal arteries. Inferior mesenteric, left colic, right sigmoid, and superior rectal. Superior mesenteric, right colic, ileocolic, intestinals. This is the middle colic artery, not on your sheet, but it comes up in courses and services the transverse colon, which is what this is. Then you have the left renal artery in red, left renal vein. Of course, there's a right as well. These are the gonadals, not on your list. The end of the abdominal aorta splits into the right common iliac, left common iliac. Each of those splits again. The right splits into the right internal iliac, right external iliac, and the right external iliac courses over the femur to become the femoral artery. So, from the femoral artery, we'll just remove the sartorius. There's the femoral artery coursing medially to become the popliteal, same blood vessel, different location, posterior region of the limb. As it remains behind the tibia, which is the weight-bearing bone of the lower limb, you have the posterior tibial artery. This one here becomes the anterior tibial artery, which I would ask if it's on your test here. Anterior tibial artery. And underneath it, you have the peroneal here, or fibula, heading towards the fibula, which is a non-weight-bearing bone of the lower limb. Posterior tibial, anterior tibial, and fibula or peroneal artery right here. Again, if I ask for the anterior, it'll be on the anterior side. Now, also, the pulmonary arteries here are in blue. This is the exception to the rule. Pulmonary veins, right side in red. So don't forget the distinction if I ask about the pulmonary circuit. And while we have the torso, this is the cephalic coursing up over the anterior deltoid. Under the armpit, you have the axillary vein. And you can also see the jugular vein. Next to it is the vertebral in blue. And over here you have the subclavian vein draining into the superior vena cava back into the right atrium. What's the name of the valve that separates the right atrium from the right ventricle? What's the name of the valve that receives blood from the right ventricle?
Say it again.
What's the name of the valve that receives blood from the right ventricle? Right, pulmonary semilunar valve. What is the name of the top of the right ventricle? Yes, there's a little region up there, it's funnel-shaped.
The oval.
Oval what? Oval,
Foramen.
oval.
Over
The
foramen.
oval
Foramen.
foramen connects the intraatrial septum to the
Right.
left atrium. Top of the ventricle. Conus arteriosum. Right?
Yeah,
How many lines do you have now?
I do.
All right. Then we have the upper limb. This is the clavicle been cut away. This is the clavicle exposing the subclavian artery, subclavian vein. All these are in red. They are arteries. So subclavian artery. You have the axillary artery in the armpit. Becomes the brachial artery over the brachium, which is the arm. Splits into the ulnar as it courses over the ulnar bone. Becomes the radial as it courses over the radial bone and forms an anastomosis here, the palmar arch. And of course, this is the, what limb is this, right or left? Helen,
Left.
are you sure?
Pass it
Yeah.
Shake its hand. That's how you know. And the stomach. This is the lesser curvature, which gives rise to the left gastric, right gastric as it goes to the right side. Gastroduodenum. This is the duodenum, the first portion of the small bowel. That's connected to the